It's important to consult with a healthcare professional for personalized advice. Several medications have the potential to cause liver damage, especially when used inappropriately or in high doses. Here are 10 medications that may pose a risk to the liver. Number 1. Acetaminophen, Tylenol. Acetaminophen medicine overuse or high doses can lead to liver damage. Number 2. Non-steroidal anti-inflammatory drugs, NSAIDs. Non-steroidal anti-inflammatory drugs, long-term use of drugs like ibuprofen or naproxen may affect the liver. Number 3. Statins. Some cholesterol-lowering medications, like atorvastatin or simvastatin, may cause liver enzyme elevations. Number 4. Methotrexate, a drug used for rheumatoid arthritis and cancer treatment. Number 5. Isoniazid. Used for treating tuberculosis, it can lead to liver toxicity. Number 6. Amiodarone. Amiodarone, a medication for heart arrhythmias that may cause liver problems. Number 7. Azathioprine. Immunosuppressive drug used in certain conditions may cause liver enzyme elevations. Number 8. Valproic acid. Prescribed for epilepsy and mood disorders. It may affect the liver. Number 9. Methotrexate. Methotrexate used for various conditions, including cancer and autoimmune diseases. It may cause liver damage. Number 10. Antifungal medication. Some antifungal drugs, like ketoconazole, may impact the liver. Symptoms of liver problems. Number 1. Jaundice, yellowing of the skin and eyes. Number 2. Abdominal pain and swelling, discomfort or swelling in the abdominal area. Number 3. Dark urine. Urine may appear darker than usual. Number 4. Pale-colored stool. Stool may be lighter in color. Number 5. Fatigue, unexplained tiredness or weakness. Number 6. Loss of appetite, decreased desire to eat. Number 7. Nausea and vomiting, feeling nauseous and vomiting. If you suspect liver problems or experience any of these symptoms, it's crucial to seek medical attention promptly. Liver issues can have various causes, and a healthcare professional can evaluate your specific situation and provide appropriate guidance. Never alter your medication regimen without consulting your healthcare provider.